Mr. Neeraj, thank you very much for being a part of this short Q&A. As we pointed out, you've been a part of our event the first two occasions, and we look forward to hosting you once again. Can you tell us what is it that you find most interesting and appealing about the Hellscape Summit? You were there first time, you were there second time. What is it that you see? What is different about Hellscape Summit?
Thanks, Annie. I am really privileged to be part of Hellscape Summit for the last 2 seasons, and I always go to my healthcare colleagues. I think this is the only summit where I am comfortable with it. It's like a healthcare mall where you enter, do shopping, and come out. So because most of the conventional conferences and senates are a panel discussion and there is a presentation. This is a forum where every healthcare administrators, the people who are directly and indirectly related to the healthcare, they come, they talk to each other for a number of time. You give a space to them where we directly connected to the CEOs of various companies and we do a product deal. So anybody who is in the hospital business, either a new hospital or a hospital which is already in place or a future greenfield project, I think that is a place where we get all the supplier, all the stakeholders. Like small thing, in the last Hellscape Summit, my hospital was looking for a hospital uniforms. And I'm struggling to get a good person who can give that. Most of the hospital use cheap products in the uniform. I get a supplier in that conference where we have given an order. So, and it is very environmental friendly, and the doctors and a paramedic in the hospital use that. And it is supplied somewhere from deep south. So it was so good. So I personally recommend to everybody this is a summit, block their date and come and attend these kind of summit. To see is to believe. I have seen that. Therefore I'm telling.
Fantastic. That's very interesting, Mr. Neeraj. Thank you for that. When it comes to products, one of the modern innovative products that we are seeing at our event is these prefabricated modules.
Yeah.
A lot of countries, maybe not so much India, but a lot of countries like China, they're really doing a lot of things with prefab. The floor or the entire building is shipped offsite and then is developed offsite and then shipped to the location.
Yeah.
Do we see the hospital business in India adopting this kind of model to aid faster construction?
See, it is not for a state-of-art hospital, but certain things in the hospitals like a procedure room, ORs and ER, we can create a modular structure. Like inside any tertiary care hospital, you find a modular OTs. Modular OT is not a conventional OTs where you bring the modular structure and make the OTs. Like if you see a cataract surgeries, now there's a flying operation theaters which come to a country and they do a number of surgery through that. So now modular way is a way where we can create the hospital, but they are not permanent structures. Certain things like ORs, certain things like procedure rooms and ER, in an event of national calamity we can create, and it is happening. So like conventional gestation period for a hospital to come up for a greenfield project, it is 2 to 3 years. Okay. So now if we can make certain single specialty hospitals, not a multi-specialty hospital, we can make use of that.
Right. So when you say that modules are not good enough for specialized hospitals, where do you think the gap is? Because the offsite manufacturers will tell you no, it is for your luxury products that you need to use prefabricated modules. That's what we hear at our event as well. So where do you think the gap is? Why is there a perception that the prefabricated modules are not of high enough standard or high enough quality?
See, as of now, because of this, prefabricated is fine, but I am saying restrict to certain areas of hospitals. Like maybe in the diagnostics, maybe in the operations, maybe in the procedure. Because patient is admission, then we do a treatment and patient has to admit in the ward. We have to monitor the patient in the wards. So you cannot create that structure. But I'm sure about that, these modular structures are good. I think so many scientific research has been done. A time will come I can create the entire modular structure. I came to know when Tata created the Nano project. They have taken the entire modular structure from Calcutta, close to Calcutta there is a place, to Gujarat. So that they have created a company, and I'm sure for a single specialty to start with, because this model in India we have not seen and people are making. I think if we can start with a single specialty hospital, say for example a mother and child hospital. So what you can do, you created a labor rooms through this modular structure for having a safe delivery, because every person cannot go to a hospital. So you can create a modular structure in a place where this LDR can be created, and we can have a modular structure for that.
Very nice. Mr. Neeraj, we're talking a lot about development of hospitals, but recently there was this very interesting article in the newspaper about how people are becoming more aware about fitness, personal fitness. Gym memberships are increasing. In fact, they're at an all-time high. People are becoming more and more aware. People are becoming more conscious. Diet control, fitness control, and generally you see people becoming more and more lean, more and more fit. This is very good for the people, but in an ironic twist, would this be detrimental for hospitals? Because if people are fit, where is the need for them to come to a hospital?
No, I personally feel it is good for the hospital and healthcare. Now people are more concerned about their health, and they're doing all those things which they want to keep their health well. More the awareness. And healthcare is not only curative. Just come to the hospital, do a surgery and go away. It's not like that. I'm sure when people are becoming fitness, eating healthy food, going to gymnasium, taking care of themselves, it is mandatory for them to go to the hospital for a periodic preventive health checkup. And once they go for a preventive health checkup, they get to know what is happening inside their body. How's their pancreas, how's their spleen, how's their heart rate and all. And through this process, planned surgeries can be planned in the hospitals. More the awareness of this healthy regime, hospital can take better care. Now the concept of home healthcare is coming up. What is this home healthcare? Because India is shortage of beds. So you cannot treat the patient in the hospital after the surgery. After the surgery, you can keep for a day or so and then transfer the patient to a good home healthcare facility where just only a physiotherapy and a medication management is done. So I think these kind of thing is very important. You must be seeing the healthcare at home concept is going up in our country.
And that will also help bring the cost down for the patient as well as the hospital. Because one of the perceptions that has just not been going away in the last couple of years is the prohibitively high cost of hospitals. I have personally heard from my own friend circle that a hospital or sitting in a hospital for any length of time is like daylight robbery, quote unquote daylight robbery, because the costs are just so high. So what do you think is the reason for such high cost? You know, you talk to a hospital manager, or you talk to the boss of the hospital at the end of the day, they'll say, no, the profits are low. You talk to the patient, they'll say, no, the costs are too high. Clearly, there's a gap somewhere. How can the cost be high and the profit be low at the end of the day? Where's the gap?
See, actually, cost is not high. See, because what I feel in government hospital, we are not doing actual costing of a process. There, you are getting everything free. We along with CI, we have done a project in which we came to know if you actually cost of a surgery, of a procedure in any government hospital. I always believe government should make the bill. Don't pay. At least we make the bill. You are doing a hernia surgery. Your bill is 50,000 rupees and we are giving 100% subsidy. Because in government hospital, we are not making a bill. Therefore, people don't appreciate the cost of this. They feel everything is free. You see, treatment constitute of 4 important parts. One is a doctor part. His procedure cost, his surgery cost. Second, all the pathology and radiology investigation. Third, your pharmacy. And fourth, hospital rooms and all those things. The hospital bill is dependent upon these 4 things. But in a government hospital, except pharmacy, everything is free. So you don't value that complementary services. I am assuring you, if we make a bill in a government hospital, it's equivalent to a private hospital. But I'm sure with the help of this health insurance, more and more penetration is there. Like if you see few years back, we are only 5% covered by insurance. And now India is around 16 to 17% covered by health insurance. So more and more people are taking health insurance. So I feel, and technology is also in healthcare now. Whenever a new technology comes, I think the cost is more. If you purchase an iPhone, on day one the cost is more. Gradually the cost comes down. I think technology is coming into the healthcare, and I think in the times to come, like you see 3-4 initiative. Now pharmacy, if you see, government is keeping a good control of pharmacy. Pharmacy cost has come down, number one. Implant have gone down. Cardiac stent cost have come down. The time to come, affordable healthcare will come. And there is no doubt about that. People don't know about hospital. They see a hospital is a big fancy building. When they come inside and see how the surgery is planned, how the procedure is done, they'll appreciate more. But now because of this competition, consolidation of healthcare is happening, and the way forward, because of the insurance, the healthcare costs will be coming down. Otherwise, insurance companies will drive the hospital to make the uniform cuts. Because more the penetration of health insurance, more will be the affordable healthcare.
You raised a very interesting point about how iPhones are so costly on the first day.
Yes.
It so happens that just today, the most recent iPhone, the iPhone 8, has been released to the world, and it will be coming to India shortly.
Yeah.
The price of the iPhone, the latest one, is going to cost 1 lakh for the top end variant. 1 lakh.
See.
Which is just outrageous.
And people don't pay 1 lakh for any planned surgery.
Yeah.
And I'm sure after 1 year, after 6 months, this 1 lakh will go to 40,000 bucks.
Exactly. But one of the reasons for that is because these iPhones are imported from the United States. Made in China, yes, but imported from Apple in the United States.
Yeah.
And each component of the iPhone, if the phone is taxed, the earphones are taxed, everything in the adapter is taxed. There's a tax rate for every single component in the box.
Yeah.
It's not a consolidated tax. The point is, because it's an imported good, and iPhones has not started manufacturing in India yet, but because it is all imported, there is a very high customs duty and customs tax. Ironically, about 70% of the medical equipment coming into Indian hospitals is also imported. Could this be a reason for the very high cost that we are seeing? And is there a way that we can reduce the dependence on foreign goods coming in by manufacturing in India?
We can. In fact, now with the help of this Government of India Make in India initiative, and there is a medical equipment device park which is created close to Hyderabad.
Yes.
So now this is a very important step which Government of India has taken. Now most of the equipment and devices will be made in our country, and I think then these all kind of tax which is imposed on any country. Like if you purchase a cath lab, if you purchase a CT scanner machine or an MRI, it comes from outside. Therefore, the cost of treatment goes high because hospital need to acquire this technology, state-of-art, cutting-edge technology. Therefore, the cost goes more. So now, with the help of this kind of initiative of Government of India with the private sector collaboration, I think the cost of treatment will go down. I'll give you recent example of implants, the orthopedic implant. Earlier, the cost of the surgery is average around 2 lakh is a cost. 2 to 2.5 lakh. Now the stands price as well as the orthopedic implant price have reduced considerably. Now the same surgery which is costing around 2 to 2.5 lakh has gone to around 1.5, 1.6, almost 50-60,000 down, which is very good. And I'm sure now the pharmacy medication is also, the cost is going down. So in the time to come, we can get a more affordable care. I'm sure about that since I'm into the healthcare for quite some time. I know what is happening.
18 years.
So now I think this technology park where the medical device will be made in India, the Government of India is asking companies to come and create the shops there so that we can have equipments and devices inside our country only. And we got a great doctors. You will see most of the great doctors in the world are from India.
Right. No, last one. I have one last question, Mr. Neeraj, and it's regarding something that's been in the news a lot of late. It's in fact created a sensation all over the world, and that's the Blue Whale app. Okay. Very challenging, interesting app. Kids all over the world have downloaded this app and followed the steps, and apparently it's supposed to make people achieve something big. I'm sure you would have seen in your hospital, because Rainbow Children's Hospital, children are the ones that are most vulnerable to this sort of madness, if I may put it that way. What is your experience of the Blue Whale app been?
Actually, I have seen the hype has been created over this Blue Whale. We have started a helpline, a Blue Whale helpline, where anxious mothers and parents used to call our pediatrician. We used to call all the children to our OPD. There is a child development center where we used to treat a child because the child are very active and hyperactive. We used to tell there are conventional ways, there are ways and means, because see now most of the parents, because their busy schedule, they are giving the phones to them. So in order to engage child, they used to give phones. So that technology come from there, and Blue Whale, we created a helpline. Our doctor counsel the parents, counsel the children. If we spend more time with the child, I think these kind of technologies you cannot distract from that. So we created a helpline. Few of the casualties which they came, they fell down and everything. It was happening.
So you have seen mutilations.
But this helpline actually helped the children, because since we are in Whitefield part of Bangalore, most of the
school
IT population is there and schools are there. In fact, we created awareness drive in school also. We have selected 10 schools close by, where our team of doctors went there and told to the teacher what to be done and what not to be done. I think spending more time with the children is the only way which we should know who are their friends, what company they keep, what they eat. We generally forgot in the busy life. So I think any blue whale or red whale will not come in our life if we spend more time with children.
Yeah, because the children that are most vulnerable are the ones that feel sort of left out, bullied in the society, nowhere to go. And so I think that kind of psychological support is very important.
See, these kind of things was there earlier also, but at that time your grandparents, you got a joint family, your chachas, your mama spend time, you got a good cousins. Now almost all child are all alone. They spend time with their friends or they're all alone at home. So they want something to do.
Yeah.
So they're passing their time with all these apps. So I think there should be a good balance between studies and phones and a TV. Then these kind of app will not distract us. It's more important.
And then we'll have a healthier society.
Yeah.
A healthier society.
I'm sure about that.
I'm done with my questions. Thank you very much. Natasha, do you have some questions?
I have one question. I had come across a lot of hospitals when I was talking to owners how laundry actually changes the entire hospital.
Okay.
Laundry equipment. So what is the strategy that you have for laundry in Rainbow? What are you looking at?
Actually, laundry inside the hospital is very important for two reasons. One, for hospital infection, because if you're giving the hospital uniform to an outside vendor, you don't have a big control over it. So since particularly most of the hospital do good amount of surgery, we should have our own laundry, number one, for the hospital infection control. Second, it is an alternate source of revenue. Suppose there's so many small clinics and so many big small hospitals, so you can pool them and you can ask them, we can do laundry for you. I think in all these 5-star hotel, if you see, there's a pooling. Everybody cannot afford a laundry. So if one big hospital within an area of 5-10 kilometer can have one laundry, and each and everything which we are processing this hospital pass through this mechanized laundry, I think is one of the fantastic thing hospital can do for a well-being. See, you feel every uniform which is used by a doctor, every apron which is wear by a doctor and a patient, if it is passed through a hospital own laundry, you have own check, you have own control over it.
Right.
Then I think this is a way for infection control as well as
some alternate
source of revenue.
Okay.
Or you can give contract to some vendor inside the hospital premises, because that is not your core area. But you should have inside the hospital, which is more important.
And there are very few companies in India also who do laundry equipment.
Yes.
So you outsource laundry equipment, or you have it from the local suppliers here?
Yeah, I feel somebody want to invest in this laundry technology. We can give a space in the hospital, and we can ask him to have a laundry inside the hospital. If there is no space available, then you can ask him to make a laundry for you outside the hospital, so that you have a control over it.
Okay.
But it is important thing in the hospital, because now more and more planned surgeries, state-of-art surgeries is happening in the hospital. So these kind of thing is very, very important.
Yeah, this is
when a hospital can invest so much time in purchasing big equipment, I think hospital will spend the time in making the investment in this area as well.
Yeah.
Perhaps there's a space crunch, especially in a city like...
No, pool it. Na? Instead of this thing, we can ask the vendor only to take a space, and there is a joint venture. So that, mostly in group hospitals or more than one hospitals can do that.
Yeah. Collaborative effort.
Because that is not a core area of hospital.
Right, exactly.
So therefore.
Yeah. So, CEOs and, the like would not want to also
spend more time on that. Yeah.
It dilutes the focus. Right. But thank you very much.
Thank you so much, and I'm very happy to meet you all again, and looking forward for Hellscape Summit 3rd edition.
Yes.
And I'm sure we'll have you have more thing to offer.
Absolutely.
Thank you so much.
Thank you so much.
Thank you so much.